So we got Greg, Jean, Jeremy, Robert, Autumn, and me, and Miss Jessie. And here she is to do her report.
How many people in this room have health insurance, but it's not even worth having because you have an insanely high deductible to meet before your insurance company pays an out-of-pocket expense? How many people do you know that are being price gouged by pharmaceutical companies in order to take a life-saving medication? You are not alone. According to the Centers for Medicare and Medicaid Services, healthcare costs in the United States totaled $3 trillion in 2014. Healthcare costs rose to $10,000 per person in 2015. When Americans do not have access to affordable health care, there is a risk that they could die from not being insured. According to facts on deaths due to lack of health insurance in the United States, there are estimates that there are about 20 to 45,000 Americans that die each year from not having health insurance. I would like to discuss the benefits of America adopting a single-payer health system, such as the one that Bernie Sanders has proposed, Medicare for All. First, let's talk about the money that will be saved with the Medicare for All plan. Single-payer insurance will save Americans a substantial amount of money in both premium expenses and out-of-pocket expenses. Healthcare should be affordable for all Americans, and this can be achieved by supporting a single-payer health system. According to a public review conducted by the Department of Insurance and the Health Insurance Exchange Marketplace, it would cost $493 a month to insure somebody with a platinum health insurance policy. This totals roughly $5,900 a year. Next, we need to factor in an individual deductible of $233 and an out-of-pocket expense of $2,403 for the year. By the end of it, it would cost $8,900 a year to insure just one person. This data represents the cost to insure a 40-year-old non-smoking Texas resident. Bernie Sanders has developed a plan called Medicare for All. For a family of four making $50,000, it would only cost $466 a year to insure all of those people. Businesses would actually save over $9,400 to provide health insurance to a family of four making $50,000. Lastly, we are going to talk about healthcare being provided as a right, which will decrease the amount of uninsured Americans there are and the potential that they will die without health insurance. Healthcare should be provided as a right to all Americans, but because some states have not accepted the Affordable Care Act, a large amount of Americans are uninsured and dying. According to the Center for Disease Control, 20 to 45,000 Americans die each year from not having health insurance. My father has end-stage cirrhosis, and he is dying. He tried to get Medicaid, but was told that he made too much money. He applied for Medicare, but was placed on a 2-year waiting list before he could even get Medicare. He needed to take a medication that cost $1,125 per pill.
Oh my goodness.
And in order for his condition to improve, he had to take 6 months of medication. Well, the cost to have this 6 months treatment would have totaled $47,250. Medicare would not cover the full 6 months of treatment. In other countries such as Canada, India, Egypt, and the European continent, it would have only cost my dad $450 for 6 months of treatment. Code Red compiled a report titled The Critical Condition of Health in Texas 2015 that discusses that Texas has the highest uninsured rate in the United States. As of 2015, Texas had a total of 6 million residents that did not have health insurance. If the United States adopted a single-payer health system, we would not have to pay exorbitant amounts to receive medical treatment. People would not be dying because they are uninsured. I would like to conclude with a powerful message that has been delivered by Bernie Sanders on several occasions. We are the only country on earth that does not guarantee health care as a right to all Americans. All of God's children, the poor, the wretched, they all have a right to go to a doctor when they are sick. I want you to think of what this great country can be. We can be a nation which joins other nations around the world, guaranteeing health care as a right to all people. Thank you.
Hey, very good. Very good.
Good job.
Right on.